and being dehydrated or not as well fluid intake can increase the hot flashes as well. And then your clothes, dressing in layers, making sure that you have cool clothes underneath and that you can take off, that one top if you're getting very hot. It's very frustrating at night. People are, covers on, covers off, covers on, covers off, sweating, having to get up at times and change their clothes because they're so wet with the hot flashes. So exercise has been found to be helpful for people. I find that exercise is kind of like one of those magic formulas that can help with emotions and stress, as well as hot flashes and joint pain. So starting some sort of exercise program can be helpful for some people. And then we do know that there is a new medication called Veoza that is now available for hot flashes. There's unfortunately not a lot of data for people with breast cancer who want to take this drug, but it is something that you can discuss with your oncology team if your hot flashes are, really affecting your quality of life to see if it's something that they would recommend for you.
Great, that's helpful. We're getting a couple of questions. Do you need a prescription for medical marijuana? And I do think this is a state by state thing. I know in Pennsylvania you need a doctor to give you a card for certain conditions, so you need to check with the state, and we probably have resources on that at LBC. Um, so, do any of you want to add some things that maybe have worked for you with hot flashes that we haven't discussed? Alicia, are you looking
Yeah,
at?
I feel like I tried a lot of the things that Diane said. One of the other things I did was I got multiple like little personal fans that I can carry around with me so that I could just open it up and use it as I need. I was very brave to wear a sweater today because usually I do wear layers, but I dressed up for this. I also have a fan on me in my room, the ceiling fan, so I have those as well. Fans everywhere.
I don't know if anybody mentioned the low dose antidepressant. Did that come
Uh,
up?
Not
The,
yet.
now,
can you talk about that?
yeah, so
I was on my
there
fans
are,
and stuff, but go ahead.
oh, go ahead, Tan, I'm sorry.
I was gonna just talk about the things that I did for like my hot flashes, but I can come back if you want me to.
No, go ahead, Tian, and then we'll get to the antidepressants.
Okay, so I did try like the black cohort.
Kohash?
Yeah, cohort. I tried that. That helped a little bit, and I do also have like a fan that goes around my neck, and the portable fans. I do keep the fans on, and I keep my house cool to help me. And again, the exercise has helped me in regards to my hot flashes. I always drink water now, and for the most part, my hot flashes have not been that bad. I keep things like off my head, like wigs and everything, because that makes me hotter. And then I realize that I have triggers when it comes to like my anxiety and my depression that makes me have hot flashes more.
Thank you. Go ahead, Evelyn.
Yeah, so thank you for bringing that up, Diane. Definitely, there are some antidepressants that can be utilized to help with the hot flashes. Again, something that needs to be discussed with your medical team because there are some of them that could interfere with tamoxifen. So it's really important to talk with your team and ensure that everyone is on the same page if you're getting it from a psychologist or someone else to make sure it's one of the ones that's safe to use based on the hormonal therapy that you're on. But there has been some really good research and patient data showing that it does help some patients with their hot flashes.
And someone is asking the question, what about testosterone pellets to alleviate fatigue, hot flashes, or joint pain? Have you had any experience with that, Evelyn?
I did not, Jean, not sure if you do.
I don't, but we will definitely research that and we'll do our best to get that back to you. We also have some people who um, are being ovarian suppressed with either Lupron or Zoladex, and saying that the hot flashes are worse at the beginning and then get better. Can you explain why that happens?
Yeah, definitely what the research shows us is that the first 3 months, with people who go into sudden menopause because we're shutting down their ovaries or have their ovaries removed before menopause, that sudden, whereas when you go into menopause naturally, your estrogen levels go away kind of slowly. So you get used to it. With these sudden menopause, it's kind of like all of a sudden, wham, bam, you have no estrogen. The symptoms can be very severe at first. But they tell you that if you can tolerate them those first 3 months, that eventually they start kind of like stabilizing and not being as severe.
Right. Okay. Thank you. Um, can you, we're getting a couple of people saying, can you once again say the name of the new medication on the market and maybe spell it so people can remember it when they go to the doctor?
It's Vioza, so it's V as in Victor, Eozah. Don't ask me to say the generic.
I know, I don't know it either.
It's very long and convoluted. I'll probably butcher it.
Exactly. So yeah, that's a good thing to, you can definitely go back to your doctor and see if that's something you want to try. We are getting some questions about when are we going to talk about the risk of recurrence, and I just want to remind everybody that last Thursday we spent an hour and a half with Dr. Borges talking about things you could do to reduce your risk of recurrence. So tonight is really about managing side effects, but I encourage you to go to our website, and I'm sure my staff will drop in the chat that link, because that's just not, we broke this up. And another question is, and we talked about some of this, but eating a healthy diet, but are there specific foods that are known to sort of make hot flashes worse or exacerbate them?
Yeah, so from the literature and from patient data, caffeine can make the hot flashes worse. Alcohol can make the hot flashes worse. And then foods that are high in sugar can make the hot flashes worse for some patients. So those are the three big trigger foods. I don't know if anyone else from the panel has any other foods that trigger their hot flashes.
No? Am I seeing any?
Yeah, caffeine doesn't make mine worse because it helps me stay up, and I don't have any issues with hot flashes on days where I need my caffeine. Yeah, so I haven't experienced any food. Also, one of my side effects is I don't eat a lot, so.
Okay, that's a different issue.
Mm.
Anyone else? Okay. So before we move on, I mean, I think we just covered a lot: joint pain, hot flashes, and sleep issues. Is there anything any of you want to add? Again, this is all about learning from each other. There's so many things in the chat. I'm just amazed always how educated all of you are and how many things you try to combat the side effects of this medication that the goal is to reduce recurrence, which is what everybody wants. We need the pharmaceutical companies to come up with drugs with fewer side effects. But did we miss anything? I just want to make sure those are big ones. So
I did want to talk to you about, the big one that everyone mentioned was the weight gain.
yep.
And how frustrating it is to gain weight while you're on this medication. And unfortunately, there's no magic formula for that, right? We just tell you to eat a healthy diet, plant-based, at the core is always the best, and then stay as active as possible. A lot of the studies show that it's really important for us as we get older and are in menopause to not just add that cardio exercise, but also to ensure you add some weights to your exercise at least 2 times a week. It helps build the muscle, break down, some of the fat. So staying as active, but there's nothing magical. I wish, we do have all these weight loss drugs that are now in the market. But for us, as we continue to, go on your cancer journey. Just eat as healthy as possible. Be good to yourself. Don't torture yourself if you gain a few pounds because it's unfortunately part of the course for a lot of our patients.
Thank you for saying that. And it is really frustrating. Go ahead, Diane.
I have something to add, and this won't help the people who are on now, but when you get on, there are some studies done now that cancer treatment, right, including chemotherapy and the aromatherapy, it really messes with your gut. And so we have this wonderful microbiome research that's being done now. And I went off last summer. I finished my last course of AIs, and I went on that reprogrammed my gut microbiome, and I was able to lose 45 pounds that I had never been able to lose during the whole 21 years of my cancer treatment. So a Canadian group did a study that showed that chemo specifically changed the contents, and then we've all been on all those antibiotics, right, from all our surgeries and treatments. And I would love to see more done with the gut microbiome. And I mean, eating the way you said, Evelyn, is going to help with that, but specifically fermented foods for a while and no processed foods. That's the kind of thing that will clean out the bad bugs and let the good bugs thrive.
Yeah, there's a lot of research being done on microbiome, so we're all paying attention to that. So thank you for bringing it up. Before we leave weight gain, and don't worry everyone, we're going to get to sexual side effects. There's a lot of questions. That's the next area, so don't worry. But one person is saying, do you sort of gain maybe that 5 and 10 pounds and then it levels off? Or do you find, Evelyn, that your patients continue to gain weight as they continue with the AI?
I think it depends how active they become. I do see that first kind of like the 5 to 15 pounds for a lot of them, and then the leveling off. I do see some of them continuing to gain weight after that.
Mm-hmm.
Uh, but for the most part, I would say 5 to 15 pounds is the average for most of our patients.
Okay. And there are some specific questions like the keto diet or other diets. And I think, again, we have a lot of resources at lbbc.org we have a lot of talks about nutrition and diet. And I think you need to figure out what works for you. And like you said, Evelyn, there's not one sort of something that's going to work for everybody.
Yeah, absolutely. Yeah, just finding what works. And I do think one thing that Diane said is really important is cutting back on the processed foods. I think that can be a great start, to a good diet.
Definitely. All right, so we're gonna move to sexual side effects because there are a lot of questions. So I think, Evelyn, do you want to start and just talk about what do you hear from your patients, and what are some of your strategies that you recommend?
Yeah, I think that listening to Alicia in the beginning, she mentioned the frustration of the decreased libido, that lack of the sex drive that can be very upsetting because it's you and your partner, and trying to get them to understand also that that's affecting you in a way that is not a happy place for you either. The decreased libido, I think, is a tricky one. There again, there's nothing magical that we have that can help that. So I usually give
Back up the
people
video,
tips in the
guys.
sense of trying to find the things that put you in the mood before. Was it watching a sexy movie? Is it putting a cute lingerie on? Is it going walking and holding hands for a while? What were the things that used to help before, and then try to revive them. It takes longer sometimes for people to reach the orgasms or to really get in the mood. And it may not be so much afterwards, reaching orgasm. It may just be wanting to even get there, to get started with wanting to have that sexual relation. So have great communication with your partner. I think that's the first step. Letting them know that you still love them, that this is not something that you are trying to do. It's just unfortunately a part of this menopause and the changes that come. with this new phase of your life. And then really try to, I do tell patients to try to stay on some sort of kind of schedule of having sex, because the less you have, the less you want to have. So, get that happy compromise with your partner. He might want to do it 3 times a week, or he might want to do it once a month. So maybe you compromise to once a week. But just trying to keep that communication and that relationship going can be really important, as you continue to grow your relationship with your partner.
Yeah, I see our Sharon putting some links to, we have done some really amazing talks about intimacy and sexuality. Want to also acknowledge that we know you may be partnered with a man or a woman. You may not have a partner, and that's a whole other issue of how do you go about dating. So I do encourage people to click on some of those links. But what about vaginal dryness, just as a one very specific side effect that obviously is also a menopausal side effect?
Yeah, that's another one that is very bothersome for the women who experience it, because along with the vaginal dryness often comes pain with intercourse or pain with any type of touch. So for that, the first thing that I recommend is having a really good lubricant, and finding one that works for you. So water-based ones are really good. You may also try a silicone-based lubricant. Personally, I love and recommend 100% coconut oil. I think it's a great lubricant if you're not using any condoms of any kind. If you are, it's not one that you should be using. But finding the magic one for you, because it's every single one is not going to work for each of you. If the lubricants are not helping, there are also moisturizers that can be used, such as Recleanse. And again, you may need to explore with a few of them to see which one may work best for you. And if neither of those work, having a really good discussion with your oncologist as to whether using some local estrogen creams may be helpful. There are some low dose estrogens. There's been a lot of studies done on estrogen and the use in women who have had breast cancer. And the studies have shown that using these low dose locally, there hasn't been an increased risk that has been seen in the literature of people having recurrent breast cancer from its use. So talk to your provider, figure out what your needs are. Start with the lubricants, add the moisturizers, and then if all else fails, consider the local estrogen therapy, a discussion with your provider.
Yeah, that's great. And someone put in the chat, seeing a physical therapist who's trained in pelvic floor. Both can be great for any pain. They're hard to find, but they're incredible practitioners. So I think that's another resource. I know it's sometimes hard to talk to your doctor about sexual side effects. So I'd love to know if, and they don't have to, but if any of the panelists want to add anything into this discussion, that would be great. And if you have had a successful conversation with your doctor, sort of how did you bring it up? No pressure.
So I'm not as sexually active, but when I was, I had a different effect. So I didn't have issues with like my libido and dryness. It was more so too much, or I reverted back to like it being like my first time again, which was weird for me. So I didn't actually have like the normal side effects that everyone else has. It was more so of the ones that we don't really speak about, which is overly lubricated and no. And I did still have my libido, so it was probably it wasn't as high, but it was still there.
And I just want to say you're not alone, that I do have some patients that have exactly what you have, where, there's extra moisture or extra discharge that they can have, and feeling great, like they want to have sex more often. So there's nothing wrong with that, and it's very, it can be seen also in some of our patients.
Yeah. Alicia, did you want to add anything?
I was just going to say that it's one of the things that definitely never comes up at my doctor's appointments. I go in with a list of things, and it's one that I never think to mention and nobody ever asks. The only time it's ever come up is when I have my annual exam with my OBGYN office. It gets mentioned there, but there's not a whole lot of recommendation from them because they're not oncologists. And so, I had the recommendation to maybe try Mona Lisa, and this was at a time where it wasn't going to be a good time to do it. So then I've asked around, and people have said it's really not as effective, but I don't really know. I will say where I am working currently, it comes up more between doctors and patients, so that's good to see that dialogue is taking place. But like I said, it's just not something that ever gets brought up in my visits on either of our behalf. So.
Thank you. Yeah, I'm going to let Evelyn talk a little bit about how maybe you can start the conversation, but just also in the chat is trying progressively sized vaginal dilators can be helpful as well. And again, I know some people, Living Beyond Breast Cancer actually partners with a company called Cal Exotic, and if you go onto our website, they have created a line of sexual toys and products specifically for women with breast cancer. They also donate back to us. So I know it can be kind of scary to go online and order something, but they're a really great company. Sharon just put that in the chat. But Evelyn, what are some ways that, if your doctor's not bringing it up, what would be a good way to start the conversation, or is it better to go to your oncology nurse? I mean, what are some of the ideas you have?
No, I think that the oncologist is a great resource, as is one of the nurses. But what I would tell you is, as someone who provides care to patients who have active treatment, sometimes we're so focused on managing the other side effects that are considered, more important, that you forget about the importance of sexual health. So make your list, Alicia. Like you say, sometimes you're so busy asking about all the other symptoms that you don't bring that little niggling one in the back, because it's also one that sometimes can be embarrassing for people to bring up. But just bring it up. Just tell them, hey, doctor, on top of, my joint pain, one of the other issues I'm having is, painful intercourse, or, just feeling dry and uncomfortable. What can I do about it? They're like anyone else. You just want to have that open conversation with that provider, because they can give you lots of tips, and sometimes it's just bringing it to the front to them that's an issue that's bothering you.
Some of the other products that people are writing about, there's a company called Bonafide, and they have a product called Reverie. I think it's mostly hyaluronic acid, which is safe. And there's a company called Fem Pharma that has created some vaginal lubricating products that are non-estrogen, woman-owned companies. So I think there are ideas out there, but and I love that everybody's putting it in. And I think a lot of doctors are more open to the conversation, right, than they used to be. And I think it's important to be an advocate. So I want to take a little bit of time, because there are questions about what about depression and fatigue. I think they're combined together, but I'm seeing a fair amount of comments and questions about that.
Yeah, so we start with the fatigue. The magic formula for fatigue, and people always say that doesn't sound right, is exercise, right? All of the studies will tell you that the best way to treat fatigue is exercise. You first want to make sure that the fatigue is not being caused by an issue like anemia or some other issue. But if it's your run-of-the-mill fatigue related to your cancer, to its treatment, and it's not due to any abnormal blood work or other concern, please start an exercise program, and you will see such a huge difference. And again, you don't need to run a marathon. You can just start walking in front of your TV, doing, if you like to dance, do the things that bring you joy, that will really also allow you to continue to do it because you enjoy it. And just start doing it. You'll notice a huge difference if you start that. So I don't know if any of the other panelists want to mention something about the fatigue or anything that helped.
I don't know if I feel fatigued until I get home and ready to go to bed, and then I don't sleep. So it's like this perpetual cycle, which I think goes into why I have issues managing all the other things because it's not my priority. I just want to sleep.
I agree. It's a vicious cycle, Alicia, the fatigue and the lack of sleep, unfortunately.
Yeah, we had one of our presenters one time said, remember the difference between fatigue and not getting enough sleep. Fatigue, you can have a long nap and still feel tired versus if you sleep well and you're restful. So it is a really different feeling where you just can't get enough rest. And I think it's important to talk to your doctor about that. Diane, did you have anything you wanted to add?
No.
Okay, how about you, Tam? Well, we know you're tired.
Yeah, I'm always fatigued. So, and I still haven't found anything to help with it. So.
Yeah, I think a lot of people are putting things in the chat and also linking some good resources. I don't want to skip over depression, but there are a bunch of questions. I guess women are having hair thinning and wondering, is this age related? Is it related to the AI? And is there anything to mitigate that?
So there are some of my patients that have hair thinning with some of the hormonal therapies that they're taking, whether the AIs or tamoxifen. And I think it's a combination. Again, if you're thrown into menopause, with menopause, we know that we start hair thinning. And then on top of that, the AIs may worsen it. We tell patients to try, some of the volumizing shampoos to see if that will help. Being gentle with your hair, try not to use a lot of heating products or harsh products on your head. Sleeping, with a satin pillow or silk pillow can help some patients as well. But unfortunately, it can happen with some patients, and I've seen a little bit of thinning in some patients. I've seen a lot of thinning in some patients. Some of the patients it comes back, some of the patient it does not come back. So if it happens, mention it to your provider. Discuss whether there's different treatments you can take. If that's something that's very bothersome to you, and then try some of those other tips to see if they help.
Anyone else have anything to add on that?
I love Living Proof, which is a whole line for aging hair. They have all the products, and it just has saved me.
And there are some questions, collagen is kind of all the rage right now. Lots of places to buy it. So they say it's helpful with hair growth. Evelyn, do you have any experience with that?
I know a lot of my patients are always asking about it. I have not heard anything saying that is harmful for patients with breast cancer to utilize. But again, there's not a lot of research out there. So, like anything, what I tell you with supplements, take it with caution, don't overdo it, and, talk to your provider about it as well.
Right, and I think it is something, if you're going to try, you have to use it really consistently. You can't just say, I'm going to take it every now and then. You got to try it for a good solid few months. And it's expensive, so something you want to make sure you want to commit to, because just doing it a little bit, I don't think will be helpful. So I don't want to skip over depression because that is real. And I'm, Evelyn, do you see that if people are on hormonal therapies, does that increase or start happening?
Definitely with tamoxifen, that can be one of the side effects of tamoxifen. So, if that happens and you notice you're getting more depressed, you need to speak with your physician, your provider right away. There are some people who have become suicidal on tamoxifen, so really important to have that discussion if you notice symptoms worsening. With the aromatase inhibitors, I have not seen it as much, but again, it can happen. For people who had depression prior to their cancer therapy or their cancer diagnosis, the symptoms can worsen because you're dealing with a whole new life, You're dealing with a lot of issues related to your cancer, and all those emotions can just worsen with time for some patients. But definitely, I place a lot of my patients on antidepressants. They may need it for a short period of time, and then things, get better, and you can slowly wean off them. Some people need to stay on them. Definitely a discussion that should be had with your provider, something you shouldn't suffer with in silence because there is help. There's not only medicines that can help, but there is behavioral health and counseling, psychological support that can make a big difference as well. And I know that I talked about exercise all of this talk, but it's another one that, exercise has been shown to help with anxiety and depression. And it's a great thing to consider trying.
That's great. Does anyone have anything to add on that? No? Okay. I'm going to give you just a few specific questions that are coming up. So one person is asking, is it safe to use E-string for to reduce vaginal dryness? And I know there's a lot about is it absorbed systemically or not? So I'm just wondering what you recommend.
Yeah, I think that is another one, that definitely discuss with your oncologist if your symptoms are severe. Vagifem, E-string, we have allowed a few of our patients to utilize it when the symptoms are very severe, but have that conversation with your oncologist and, decide with them the risk versus benefits, and if it's something that may be important for you to try, and to start.
Okay, great. And I just want to say that, a couple of people have said, they want to know more about sort of the risk benefit of taking hormonal therapy, quality of life versus risk of recurrence. And I just want to remind everyone again that Dr. Borges did talk about this last week. And I think it's something you need to talk to your doctor about, whether you can lower the dose that you're taking, switch to a different therapy, if possible, stop, depending on your situation. That we have a lot of long-term studies now. So if it really is impeding your quality of life, I think we really encourage you to talk to your doctor. And again, Dr. Borges did address this. And just so for those, I know we do have some people listening tonight who have triple negative breast cancer, and obviously hormonal therapy is not part of their treatment. Dr. Borges did address issues for all subtypes. So, but this tonight was specifically on hormonal therapy. So I can't believe it, but it's 8:10. So we're going to wrap up. But before we do, I wanted to give each of you a chance to say anything either you haven't said, or did you learn something, or for me, I'm just amazed at the incredible community of support. There are hundreds of people listening tonight, so you guys are not alone at all. And so I think when you're lying in bed at night, not being able to sleep, just remember there's a lot of people awake. Maybe you need to find each other and connect. So, but yeah, Alicia, anything you want to end with?
I don't know that I have any tidbits of information, but I think, like you said, it's always nice to know you're not alone. I know that a lot of the things that we talked about are experienced by a lot of people on these medications. So thank you for having this event tonight.
Great. How about you, Tam?
Same as Alicia, I don't have any tidbits for anything, but again, I do experience more of the severe side effects of everything that was going on. I may have not said it because, my brain got lost in chemo brain. But I did have a question because I don't know what trigger finger is. And I wanted to know exactly what that was. And I wanted to see if I actually experienced that because I do have issues with my hands and I just am interested.
Can you answer that, Evelyn?
Yeah, it's basically your finger that kind of
Yeah, I
gets
used to
locked.
have trigger finger.
And it's
I had
and
a
it, yeah,
surgery
it just becomes
to do that.
I
Yeah,
didn't
and
know that was part of the rheumatoid inhibitors, the AI. So
yeah, and it's not that uncommon, and it can be really challenging.
Trigger finger is
So
awful.
if you do think you have it, talk to your doctor. Good question. Always ask when you don't know, right? Diane?
I would just say that it's, I think, incredibly important that doctors, when they prescribe the medicine, that they tell us about the side effects to expect and spend as much time on the mitigation, like how to work around these things. And then we would get many more women staying on the AIs for the full time they're prescribed, because we know they're very powerful in stopping the cancer from coming back. I mean, the research is incredible, right? And so if we just knew what to expect, that would help us. So don't be afraid to ask your doctor, would be my advice.
Yeah, Diane, that's great. And I just want to add, for those living with triple negative breast cancer, they would be so happy to have something they could take for prevention. And we're hopefully going to get there. So, it is great to know you have a great, and a lot of them in the arsenal to try. But I agree, doctors need to say more. I want to say it's been really nice. I've seen a couple people in the chat say, I've been on hormonal therapy for over 3 years and I have no side effects. So I do want to acknowledge that there are, as Evelyn said at the beginning, not everybody does experience this. We never want to scare people. So I think it's important to say that we're all individuals. And how about you, Evelyn? Do you want to have some closing remarks? You've been amazing and compassionate.
Thank you for having me. I would just say that having a great communication with provider is important. Don't ever be afraid to ask any questions. And even things that you think may not be of importance, like talking about your finances or your job or other things that are preventing you to getting back to your normal life. Speak about it. You might be surprised that there may be resources and support for you.
That's so important, right? There's so many things. I mean, we could do a whole webinar, obviously, on financial toxicity and other impacts that cancer has. So, and we do that. But thank you, Evelyn. So we are going to end, but I want to thank the panel, Alicia, Tan, Diane, Evelyn, for your time, for your openness, for your willingness to help others. You've been extremely helpful. I want to also thank all the people that have joined. I mean, this chat is unbelievable. We'll download it because there's so much good advice in there, and it's moving really quickly. I also want to thank our sponsors once again. This is how we do our work. So our presenting sponsor, Lilly, our title sponsors, AstraZeneca and Novartis, our signature sponsor, Merck, and our supporting sponsor, Natera. I do want to remind everyone, this recording will be on our website, along with the one we did last week with Dr. Borges, so you can watch it again, slow it down, and share with others. And again, remember, you will be getting that evaluation form emailed to you, and we really do hope you'll fill it out. In the chat, there were a lot of information that, Living Beyond Breast Cancer has a helpline. If you want to talk to someone for peer-to-peer support or want to join one of our closed Facebook pages, we'd love to add you on, and there's information on our website. So thank you again, and have a great evening, everyone. Thanks. Bye-bye.
Hello, everybody. So that was a Zoom meeting. I missed last week one. I just put this one in my phone.
I haven't used it in days.
We got this.
Come check out Downlight.
We got this.
We got this. Life is for living.
We got this.
From Carmen Performance, Edward Jones.
So who's here with me? So ladies, don't be ashamed if you have something going on with you. Talk to your doctors. Talk to the doctors. So as I say, they sent that thing to me because I had the breast cancer. So it was a webinar. It was like on a Zoom. So learn a lot. Well, it started since 7 o'clock. I didn't get the full. I didn't turn it on at the beginning, but it's good to listen to some good information every now and then. All right, guys. Thanks for watching. I'll come back with a different live. I don't want to mess up this one. Thanks for watching. Bye.